So during this moving meditation, during this session, I'm going to talk a little bit about vigorous exercise and how it affects all-cause mortality and cardiac risk while getting my reps in. Today I'm going to work on my clean and presses, get a little bit of stick work for my wrist mobility, my shoulders along the way. But for the most part, I'll be talking at an easy pace, getting my reps in with this bell while talking about hard stuff. Let's get to it. I'm going to start with a brief warm-up, just because I've been working on my various kinds of splits for the past several weeks. Last night I was getting a lot of volume, specifically with pike lifts and variations of that. So my adductors are a little sore than usual. It's a little bit tighter than usual. So I want to give some attention to deliberately opening everything up. It's not necessary to stretch before exercise. And depending on what kind of exercise you're doing, stretching can be contraindicated, as in don't do it. But mobilizing, movement prep, right? Articulating your joints, that's generally a good thing, regardless of the kind of training, because it primes you to do the things you're about to do, but not in a way that takes away some strength. The implication is that most forms of stretching, at least short term, will take away from your strength. That's the important piece from there. Okay, let's get to it. So what is vigorous exercise? We should probably start with a conversation about what is exercise, or how do you grade our exercise. As we go into discussions about how hard to train, it becomes increasingly important to have a way to discuss difficulty and intensity in a way that is consistent. Is it about feelings? Is it about your sense of how hard something is? In regards to intensity, formally, if it's endurance, aka cardiovascular work, we gradate intensity as a function of your VO2 max, as in what percentage of your maximum capacity for oxygen consumption are you using. In terms of weightlifting, right, strength and resistance work, we go as a percentage of your 1 rep max. For the academic types and for those who have the access, it's good to know that. But for many of my patients, like the ones who train in this exact garage, we don't have those tools. One, because they're expensive. And two, I have a bias towards selecting tools and methodologies that my patients and my athletes can apply on their own with a minimal need for me. That gives them some independence. It also increases the frequency with which we can gather information. Right? Imagine you need a sophisticated tool every time you want to measure something. How often are you really going to do it? Versus check your heart rate. How you do that? Learn how to check your pulse. Vigorous activity, roughly speaking, vigorous and high intensity are more or less the same in this context, is that intensity of exercise where you cannot speak while doing it. If you can speak while doing it, it falls into that moderate category for the most part, right? Notice, as I'm moving, as I'm talking, I can still talk about some relatively difficult things, actually. It's a fun brain task. But as I'm doing so, I have to take breaks to catch my breath. I have to take breaks to think a bit more than usual because I'm multitasking the system. But moderate is when I'm passing something that the strong first guys refer to as a talk test, as in Can you get out a full sentence or two without losing your breath before having to gasp again? If you can, you're in that moderate zone. If you cannot, then you have stumbled into the high intensity place. Which again, that's not good or bad. It's what are you training to do? Formal exercise guidelines for the country recommend that you get a certain amount of moderate exercise or a certain amount of high intensity exercise. What's interesting is, as the literature develops, we're learning that they're not actually the same thing, right? We used to think that moderate versus high intensity cardiovascular activity were like different doses of the same medicine, right? Oh, your blood pressure gets pretty good on 20 milligrams of lisinopril. You know what? Let's run 40 instead. We need to get it down a little bit more, right? It turns out vigorous activity is actually everything moderate is, plus more. So it's less like taking lisinopril at a higher dose. It's more like saying, hey, that lisinopril is dope. Have you met hydrochlorothiazide? And taking both at the same time. Why does that matter? Today I want to highlight the importance of doing things that are difficult, doing things that are high intensity. There are two very important points I want to highlight first. The first one is that for many folks, about 20% of those who use moderate intensity exercise for the sake of their blood pressure, for their lipids, for their metabolic health, etc., about 20% are non-responders. Now, 20% means there's an 80% chance it's going to work. But if you're one of those 20%, then what are you doing, right? You put all this work in. To get no response, it's disheartening. Pun moderately intended. For those folks who are non-responders to moderate intensity cardiovascular exercise as it pertains to their cardiac health, defined as their blood pressure, their lipid numbers, or let's say their cardiac performance in a stress test or assessing the VO2 max, it turns out those populations respond really well to high intensity work. That in and of itself is important because you have to know that moderate intensity exercise from a dose time perspective takes about 2 to 3 times as long as vigorous work. As in, I might recommend 40 to 60 minutes of moderate intensity activity. But if you can put out high intensity work defined under your own parameters, then you only need 15 to 20. And oftentimes for us busy professionals, parents, people trying to survive in this economy, the difference between 15 versus 40 minutes is the difference between I'm going to do this today or, man, I'd love to, but I don't got the time. There's also something to be said about confidence. There's a 20% chance if I do this the long way, the not easy but easier way, I might not get what I'm looking for. But if I can commit less time to doing the harder thing, then it's almost a guarantee. That's a risk-benefit discussion that you deserve to have. And then you decide as the patient, right? You might still choose moderate, but you don't have a choice if you don't have knowledge. Knowledge is power. Reading is fundamental. The other thing is vigorous exercise, when it comes to certain aspects of cardiac remodeling, is just frankly superior. You get better cardiac muscle growth. You get better changes to elasticity, as in how much your heart can expand and contract in response to blood volume. It's also something worth noting that it also trains your body to tolerate the stress, the sympathetic and cortisol event that is high stress, in a controlled setting. And that actually carries with it real benefits. There's a guy I'm speaking with where we're trying to use that concept, right? High intensity cardiac exercise timed appropriately throughout the day to improve his heart rate variability, using that as a correlate to see if his sleep will improve. There's another guy. Same thing. We're using the controlled application of stress and adrenaline, high intensity exercise, to get his body pouring sympathetic into the system, to then force it to relax afterwards as a means to lower his blood pressure. It's an adjunct to his current medication regimen. And we're seeing some good results. The high intensity activity also functions as a gut check. Because you can't just tell somebody who's never trained a day in their life to go hard. They will die, or they'll get hurt. There's actually a really fascinating and sad case from this old show called The Biggest Loser, where this lady who hasn't really done much with her body ran a mile in California in the heat as fast as she could for the first time. And she actually had to get taken to the hospital afterwards because her body was so unaccustomed to that kind of stress that she went into kidney failure. She survived, she lived. In fact, it's on the Netflix documentary about Biggest Loser. It's worth a watch, actually. But you can't just go into high intensity work out of nowhere. It will hurt you. So you have to train enough to be capable of doing it, which almost makes it like a badge of honor, right? You do enough prep movement and moderate intensity work. You build a good baseline foundation of fitness, and you get to cash in on that by doing harder things. Why the hell would you do that? Because you get to reduce the amount of time you need to work. You also get to express your body at a higher level, right? There's benefit to it for its own sake. I'm stronger, that's good enough. But it's worth considering that not only am I stronger, but to get my reps, to protect my heart, I don't need to put in as much time as if I was a weaker person. And that's cool. That's something to be proud of. I earned the right to go hard. But that's the idea there. Train your body to handle stress and not freak out. Train your body to handle stress and not die. And the benefit you get is regular life becomes easier. And that's metaphorically true as much as it is physiologically true, right? By pushing my heart to its limit selectively and allowing for time to recover, my heart gets strong enough that the labor cost of day-to-day life is less arduous. I don't get tired the way that a lot of my peers do. I don't get sleepy. I don't get all that type of stuff, right? And it's not because I'm special. It's because I'm trained. And that's an important thing to consider. How much of this is talent versus how much of this is training. For those who've known me for a long time, I was an obese kid. I was not fit. This is all secondary to my profession, right? I became a doctor. And as I evolved as a physician, I learned that the answer to a lot of these problems is training. And I didn't have I couldn't be the guy saying that, oh, to get good, you should train, and not live up to that myself. And so I ended up making a decision that training became not just part of how I take care of people, but it became how I take care of myself in front of them, so I could walk the walk with my folks, with my patients, with my athletes. There we go.